Hello and welcome to the George Brown College Restorative Dental Hygiene Program information session. My name is Melissa Crawford and I am the Program Coordinator and Professor in the Restorative Dental Hygiene Postgraduate Certificate Program at George Brown College. In this session, I will provide a program overview to include the admissions requirements, strategies for success within the program, and I will speak to the courses and workload and give you some additional contact information. A registered restorative hygienist is a practicing dental hygienist who holds a specialty certificate in restorative dental hygiene from the College of Dental Hygienists of Ontario. The specialized education allows the restorative hygienist to perform restorative procedures in addition to traditional preventive dental hygiene skills. At George Brown College, we've been training restorative dental hygienists for over 40 years, and we have an awful lot of experience. We have clinicians that have had many, many years of experience, and they bring that expertise to the clinic when they are teaching you. It's a full-time program, a 2-semester program that's condensed into 3 days per week with one intake in September. This allows you to work in addition to attending school. This program is designed for the working professional who is seeking to expand their scope of practice to build their expertise in restorative dentistry. The program is delivered in an online and face-to-face format for both semesters 1 and 2. Pre-clinic and client care clinic on-site allows for an experiential learning experience, hands-on, and that's the way to go. Delivery is subject to change pending COVID restrictions. We don't have control over that. Presently, we are on site and we are delivering virtually and moving to face-to-face. Why would you want to become a restorative dental hygienist? Within George Brown, we work collaboratively with the dental assisting, denturism, and dental technology programs. So it gives you an overall view of other dental programs, which helps you within the restorative dental hygiene program. You would want to become a restorative hygienist because you want to increase your scope of practice, or simply having a new interesting challenge, or simply wanting more. If you have an artistic flair for aesthetics, it's wonderful because you can actually bring that artistic flair that you have and that artistic knowledge and skill, because a restoration really is the blending of art and science together. If you work in a very busy restorative dental practice, what that will do is it'll alleviate the wait list for the clients that they're waiting for their restorations or their crown and bridge. And it opens up time for the dentist to work more on implants, etc. And so that's where a restorative is utilized within a busy restorative dental practice. Also, as an alternative for a dental associate in an office, obviously within our scope of practice, but we can also help and, as I said, decrease the wait time for clients to come in. Often the dentist actually asks their hygienist who works well within their practice to go back into restorative, and they do. They encourage, they support, they see that they have a talent for seeing aesthetics and seeing the restoration and having an eye for it, and they'll encourage you to go back to school and they'll support you going. And then also just wanting to work collaboratively with the interprofessional team. As I was saying, that we do work with the dental assisting. They come in and they help us in second semester when we're in client care. We work very closely with the denturism program, where they have clients that need restorative work and they come into our clinic and we complete the restorations, and they go back and they have their partials fabricated. But we do work with the students because they need to tell us what contour they need for different types of partials, etc. The admissions requirements for to apply for the Restorative Dental Hygiene program at George Brown College is that you have to actively be registered with the College of Dental Hygienists of Ontario, so the CDHO. If you are from another province and you are a registered dental hygienist in another province, you can apply for the program, but you would have to previously have applied for a registration within the province of Ontario to meet those academic requirements. In addition, minimum 1 year dental hygiene experience, often it's 5 to 10 plus, because the more experience that you have, the more teeth that you have seen, it just makes a better restorative dental hygienist because we have just seen more. So the way that you apply is you go on to the Ontario colleges, so OCAS, and you apply to the program within that site. There's also a link to that within the George Brown website platform itself. If you want to go into that, it will link you to it. After you do that, you will then be asked to provide documentation, and it would be your official transcript. You will need to have proof of credentials required. You will have to show your, inclusive in that is your dental hygiene diploma and in addition, your CDHO registration for the year. You would also have to provide a resume and then proof of experience of a minimum of 1 year, as I was saying, which could be in the format of a letter from your employer, or if you're working as an independent dental hygienist, then just proof of that you own your own practice. So the success in your program truly is from within. You need to be wanting to learn more and willing to learn more. So to be successful in the restorative dental hygiene program is reflective upon the ability to have and develop a high level of manual dexterity. You need to have very fine motor skills to be able to create those beautiful contours that are involved in creating a restoration, to be able to see it visually as well. But manual dexterity, a high level of it is required. We can develop it, as you all know, dexterity can be developed. You also need to be highly motivated to learn new skills and increase your knowledge, and you need to be able to open up and be able to want to learn more and to be accepting of that. You need also have good communication skills while working with a dentist and your peers as well. And you need to be a self-directed and self-reflected learner. You need to be able to critically think. You need to be able to assess quickly because you are working on your own. So that's in order to be successful in the program, you need to be able to have those characteristics. And then in addition, you need to be able to manage the increased academic workload. Within the school, there is a large amount, as I was saying. It's a full-time program that's condensed into 3 days a week. So there's an awful lot of work that you do need to do at home. There's projects that you need to do at home in addition to other things. But you need to be able to manage that to be successful. You need to be able to manage working still at your dental office, your family life, etc. Majority of the students do work outside school, so they're working, generally school is Monday, Tuesday, Wednesday, and so I've had students that have worked Thursday, Friday, Saturday, Sunday, and have children at home. So you just need to be able to, within what is good for you, be able to manage the academic workload. So the courses are delivered in a combination of face-to-face and online blended learning formats. So what they have is the blended learning. It's a combination of synchronous and asynchronous online learning for theory. So synchronous just means that you are working with you're on at the same time as the professor. Asynchronous means that it's loaded onto, so the course is loaded onto, or that lesson is loaded onto Blackboard, which is our online learning management system. And you learn on your own time, which really works well for the working person. The pre-clinic and the client care clinics are on site along with the laboratory courses. They are on site. And as I was saying, Blackboard is the George Brown online learning management system that we do use at George Brown College. College. You also have to have additional technology skills are required. Your computer knowledge needs to be there. We're moving into digital dentistry, so you need to be able to work within the digital world. It's a wonderful expansion of dentistry, and you just need to have those skills. So in the course Workload, within the first semester, what you'll be taking is Science of Dental Materials, and that's taught both virtually, and then you come on site for the lab component of it. And then Advanced Dental Histology and Embryology is a virtual course online. Preclinical Techniques is a combination of both preclinic on-site working on mannequins. So you'll be working on mannequins in the first semester to hone your techniques and your skills. And then there's also a theory component attached to that course, and that's taught virtually. And then we have occlusion and aesthetics, and that has a lab component as well. You'll be fabricating morphology teeth and doing a smile analysis. And so a portion of that is virtually online. In semester 2, we have Preclinical Techniques 2, which is a course where you will learn how to fabricate provisional restorations, which are temporary restorations. You'll learn how to take digital impressions and PVS impressions, and that is both online and it is a lab component to it, which is on site. And then Clinical Techniques Theory is online and it's virtually taught, and Clinical Techniques Practical is client care. So in second semester we have 2 days of clinic, and it's on-site clients, and you'll be doing restorations on clients under the supervision of restorative instructors, in addition to dentists are working with us. And then we have field placement, and those are inclusive with lab and dental practices. You go back to the practice that you're working with, or you go to and you observe a restorative hygienist that's working within a dental practice. And so what we have is, after you've done that, there's something called the scope of practice, or the guidelines within the Ontario Dental Hygiene Association, or Dental Hygienists of Ontario, or CDHO. So these are just snippets of what you will be able to do within your scope of practice. It's an addition onto the traditional dental hygienist. So you'll be able to place matrix systems and bonding procedures, the placement and finishing of composite and amalgam restorations, the processing of CAD/CAM restorations, which is CIRAC, PVS and digital impressions. So PVS is polyvinyl siloxane impressions or digital impressions. And you'll be learning how to fabricate a provisional restoration or a temporary restoration. And you will also be able to bond permanent inlays, onlays, and crowns. So that's the scope of practice within the guidelines with the CDHO. With the interprofessional experiences, I was saying that when you are at George Brown College within the clinics, we really do work quite closely with dental assistants. They come in and they help us with our client care in our second semester, which is a wonderful, it's a win-win learning experience. They're learning and we're learning, and we work collaboratively together. As I was saying, we work with the denturist program, the denturism program, and we learn how to place a restoration where a clasp will be fitting or a precision partial will be sitting on. And then in addition with the dental technology program. So in regards to the employment opportunities that you have, majority of the restorative hygienists that graduate do go back to the office that they previously have been working in, or they find a new job, but they go back to the private dental practice. And in addition to that, they could also work within industry with dental products. They could go into sales, or if they have their own independent dental hygiene practice, they could work there as long as there's a dentist working with them, etc. Or they could go into community health practice. So it really does it does help in a dental private practice, because it does decrease the workload for the dentist, which allows the dentist to do other things that they want to do, you know, implants or etc. It just opens up the schedule for clients. And if you have worked in a practice for a long time, you already have a great rapport with your clients and with the dental team itself. So the clients are quite accepting of restorative. You already have a previous relationship with them. So there's, you know, a multitude of places that you can work with your specialty designation as restorative dental hygienist. So this is just the contact information. My email is up there. It's mcrawfor@georgebrown.ca. You may reach me through email. We also have, if you want to visit the George Brown website, and in the search bar, you just type in restorative dental hygiene or S400, which is our code. It will actually bring you to the landing page for restorative dental hygiene with additional information, but it also has a wonderful video that goes into a wee bit more detail in regards to the program itself, and it also interviews a student, so you can get a student's perspective of what our restorative dental hygiene program is. So I would like to thank you very much for taking the time to listen to this session, and hopefully we'll see you in the coming years. Take care and have a great day.